Thank you for having me. My name is Abby Ciampa. I'm a nurse practitioner in the Adult Survivorship Clinic at Dana-Farber. And today I'm going to be speaking to you on the topic of what to expect from a survivorship visit and the care that we provide. So throughout the talk, my objectives are going to be the following to lead you through this information. I'm going to talk a little bit regarding an introduction to cancer survivorship, why the care matters that we give, issues pertinent to survivors' care, the focus of the care that we give in the survivorship setting, and an overview of survivorship visit and care provided. So it's important to start with a definition. Both the National Cancer Institute and the National Coalition for Cancer define survivorship essentially as a person who has had cancer. So this spans quite a distance. It's from the time of diagnosis for the balance of one's life. And the definition is very broad. It also is meant to include the loved ones around that person, the caregivers. And so in practice, what we think about is focusing on people who have been through cancer in some way. Perhaps they're in a monitoring, watch and wait period, perhaps they're on stable medications, or they've been treated and cured and they're living in the aftermath of cancer. So generally speaking, we see patients who are somewhere in that part of their journey when the completion of active therapy has begun. Cancer survivorship issues really span the entire cancer journey because, as we're saying, this is quite a broad definition. And so just like when we treat someone for a specific cancer, we don't just give everyone the same treatment for colon cancer or breast cancer. We don't treat everyone the same. And the same is true in survivorship, that we know that there are going to be different needs that vary among different cancer survivors. And we're careful really not to take a one-size-fits-all approach. And research showed that early survivorship care actually suffered when we were trying to do everything and focus on everything for everyone. And we've been much more successful in tailoring to the individual. This is a slide to really depict a few things, to show just how substantial the number of cancer survivors in the US are growing over time. In 2019, there were 17 million cancer survivors, and this is estimated to grow into the high millions over the next decade. And as you can see, the most screened for cancers, breast and colon, for example, these are highly curable in most cases. They're also screened for. These are the highest numbers we would expect, but not insignificantly, there are large numbers of survivors in other diseases. And this is a further breakdown to show over time just how many survivors there will be of all these different cancers. This is not a bad problem to have, but it also speaks to the type of care that we have to tailor to both an aging population, people are living longer, and how we meet the needs of each individual survivor because of their individual journeys that they've gone through. So why does it matter that we give this type of care? And it's really that we know that people have problems that need to be tended to, and we need to focus on prevention. We need to focus on those that are cured and to make sure that they still feel well. And we need to control any issues that may be bothering someone. And there's a lot of research to show that initially there was an overuse and an underuse in follow-up care in the survivorship setting. And by that, I mean, even now, sometimes we can come across this. If someone comes to see me and I'm going to do their annual breast exam and they've just seen their primary care a few weeks before and their gynecologist, and maybe they even saw their breast surgeon because they're still in follow-up there, and they're getting all of this care sort of grouped together and we're all doing a breast exam, and that's not the best use of both that person's time or medical resources. And so that can be sort of an overuse of an example. On the flip side, there can be serious consequences that occur if someone has an underuse, meaning if they just follow with their PCP and they don't receive perhaps all their cancer surveillance that's needed, or they just follow with an oncology provider and that provider is not checking things unrelated potentially to their cancer, like a cholesterol panel or getting them their flu shot. And so the person sort of misses out on the key things that each discipline can provide. And so we really need to find this middle ground, and there needs to be collaboration and coordination of care, and survivorship care can be that place. And that is what we strive to do. There are so many different concerns that people have after cancer, both from a physical standpoint and emotional standpoint, how to sort of re-enter their prior life. There are potentially concerns about economic impact of the cancer that they've had. Maybe they've been out of work. So we really take into account that everybody has different needs that we need to address. It's an emotional roller coaster. When someone is diagnosed with a cancer, they're surrounded by their medical team. They are ushered through the treatment options. They quickly get into treatment. The goal is to cure this cancer, hopefully. And that can feel very overwhelming, but it can also feel very supportive. And you don't have a lot of time to think there. And then you go through that treatment and you might be feeling physically better, that in the cancer is in remission and gone. And then the emotional side effects of all that you've gone through can hit you, and you can feel angry, you could feel scared, what will happen next? The other thing is that eventually over time, the oncology team may have you come to see a provider like myself, and you can feel like, what just happened? And my team has changed, and will I get the same care from this person? And the other thing is that when we're diagnosed with a cancer, there's lots of emotional support and from family and friends. And suddenly, you're done with treatment, and your friends return to their lives because they have their lives, and maybe the visits and the meal train and the help with your kids and all of that sort of goes away because you look great on the outside, even though you may not be feeling great on the inside. And so our patients deal with a lot of different emotions. And we have supports in place to help address these needs. I think of cancer survivorship sort of in these 4 categories, and we try and monitor and care for all of these needs. So the first would be recurrence, watching for recurrence and new cancers. And this is a big one. People focus on, is my cancer gone? Will it come back? What are my risks? Will I get another cancer? Did the treatment that I get cause me any risks? Falling in this is sort of those carrying a genetically driven cancer history, or maybe they didn't have genetic testing when they were diagnosed because the family history really didn't qualify, or there wasn't testing the way we have it now, and now we have expanded panel testing, or the family history has changed. So there's a lot in this bucket that is not just about, getting a colonoscopy or getting a mammogram. There's also addressing modifiable health behaviors. And by this, I mean things like diet, exercise, alcohol intake, smoking, things that we know we need to either do more of or potentially stop. And so we talk a lot about healthy living in terms of being active and the data there in cancer survivorship, and trying to have our patients aim for things like 90 to 150 minutes of cardiovascular exercise every week, or healthy diet for those who have had a colon cancer. We know that they should have a diet in good fats and less red meat and more fruits and vegetables. And we know that these things are associated with better outcomes in the long run in terms of cancer recurrence. And so we talk about a lot of different ways to help someone modify their lifestyle to have the healthiest outcomes. This also involves weight management and smoking cessation. There are a lot of resources that we have for that. Long-term and late effects is a category that is very important. Some cancer survivors have things that are physical, like neuropathy from chemotherapy, and although it's improved over time, it still exists, and this causes both a psychological and a physical pain or annoyance or nuisance. And so we try and recommend things that might help that: exercise, acupuncture, things like that. There can be other things that aren't so tangible, such as fertility issues after chemotherapy or skin changes from radiation. And lastly, coordination of care, as I mentioned in the other slides, are very, very important in terms of survivorship care, because it is needed. It is needed in order to coordinate with specialists and primary care in order to keep someone healthy overall, looking at making sure they're up to date with their health screenings that are age appropriate and getting the care they need from all of their medical disciplines. There are additional concerns of cancer survivors following treatment. As I mentioned, both emotional concerns, mixed feelings. I'm cured, but am I going to stay this way? There is a fear that, like I said, they've lost access to their oncology team. And what does it mean now that they're not being followed in the way that they were followed? Is this new person trained in that way? That sort of thing. Any illness that comes up, you've gone through cancer, the most terrifying thing. And now, any illness, any symptom, is this cancer related, can be very scary, even if it seems that it really is not. So offering reassurance there is something that we do. The returning to normal life is certainly a big step following completion of treatment and no longer having cancer, because what was quote unquote normal before, your job, your social networks, whatever it was, that can feel very daunting to go back to. And same with intimacy with partners, or even feeling a lack of social support, as I mentioned, that now that the cancer has been cured and people say, you look wonderful, you're cured, this is so great. Sometimes people don't feel so great and do actually need extra support. And that's a really good time for us to tap into professional resources, like through our social worker and different therapists, to help with that, and support groups. Any issues that were sort of put on hold during a cancer diagnosis can come back. And so it's important to be able to support our patients in any way that they need during the aftermath of treatment. There are some positive psychosocial late effects, though, and it's that, people come out of this experience with greater spirituality often. They feel more satisfied. They've had a different perspective, a greater appreciation for life. Maybe they're now feeling like, I didn't exercise before and I've gone through this thing, and now I really want to live the healthiest life that I can. It opened up a window for them to realize that they can be a healthy individual. They can stop smoking or drinking or whatever it is to improve their health. Sometimes people gain quite a lot of strength from going through something like this. They're able to deal with a lot more adversity because they have faced such a big challenge and overcome it. And just being aware of themselves and advocate for their health. So in terms of preparing for your first survivorship visit, there are a couple of concrete things that I would mention. It would be very important to authorize release of any medical records from outside facilities before you go to your visit. The things that help us to understand our patients and their risks are knowing, obviously, their diagnosis, but how they were treated. We also want to know who your primary care is and your oncologist if you're still being followed, because as I mentioned, the collaboration is very key in survivorship. We'd also like to make sure we have a current medication list, and you should make a list of any of your questions. In the initial survivorship visit, this is essentially sort of the top key things that we think about in terms of preparing and discussing with you. We will always go over your treatments received. We will look at the follow-up care and the timeline of that care. If you are someone that still needs imaging or labs, we will ensure that those are done. We will look at if any late or long-term side effects persist. This can also be emotional, not just physical. We'll think about any disease-specific concerns you may have. We'll tell you things to watch for specifically related to your prior disease, reasons to call us, and we'll offer you resources for cancer survivorship. Generally speaking, as I mentioned at the start, a good time to do your initial survivorship visit is when active treatment is complete. This could vary. This could be when you're on a very stable medicine for many years, like a preventative medicine like tamoxifen, or this could be when someone is still being seen by their oncologist every 6 months or so, or even every year, but wants to start addressing some of their issues that they think fall within the survivorship realm. And it could be maybe a one-time consult, or maybe they come back after they're completing their surveillance with their oncologist. So that's the timing. Again, we review the diagnosis and treatment. We update your health and family histories, your medicines. We go over any symptoms that may be related to your prior treatment. We perform a physical exam. We ensure that, as I mentioned, all imaging, lab work, anything that's appropriate to your care at the time is done if you're not having that done through your oncologist. And we review your age-specific cancer screenings to make sure you're up to date with vaccinations and anything specific to your age, such as a colonoscopy. We will create what's called a treatment summary for you and your care team. This is sent to your primary care as well, and I'll get into what that means in a moment. We'll discuss additional resources to meet any needs you may have. Maybe you need a specialist in cardiology because your chemotherapy affected your heart. Maybe you need a specialist in endocrinology because you had radiation near your in your neck and it affected your thyroid. We can make connections with genetics if you're interested in genetic testing now, or seeing if you're eligible for that. Or maybe you had testing such as BRCA testing at the time of your diagnosis, and now we have what's called expanded panel testing, and that would offer you more testing that if you were eligible for. We'll also look at additional psychosocial support such as sleep hygiene, sexual health, tobacco cessation, social work support, and we'll provide you with resources for wellness, both alternative therapies like massage and acupuncture, nutrition, and exercise. So the Commission on Cancer is really what guides our practice, and at the current standard of 4.8, this treatment summary plan that I mentioned a moment ago is actually a requirement to be given to patients, and it's a key component of the initial survivorship visit. And it's a multi-page document. It outlines your cancer history, the surveillance that we'll do, reasons to call us, important lifestyle behaviors, and health guidance, as well as resources both online and in person. And the benefits of the survivor care visit, this first visit, really are many. There are medical benefits, of course. We're screening for your prior cancer. We're hoping to catch anything early if something were to occur. We're trying to prevent conditions that could be avoided, such as trying to prevent, the development of diabetes. If we see concerns for someone who may not be that active or may be struggling with their weight, we hopefully can prevent lethal late effects of your prior treatment. We can address psychosocial distress if there's any. We hopefully can improve your quality of life through any of these things. And there are benefits to you too. This visit, getting the care plan, these empower you to take charge of your well-being. In the care plan, we list all of the important information in one spot. It allows you to have a record keeper. It allows you to know what side effects to watch for and things of concern, and it lists what follow-up is needed. So as I mentioned, the survivorship visit could be done as a one-time consult. It could be an annual visit. It could be consultative when needed. Talk with your care team and see if this is appropriate for you. And survivorship care can continue with primary care, with your oncology team, or with a dedicated survivorship clinic. The road ahead for survivorship is bright and long, and there is so much that we can accomplish. And I do encourage you to reach out to your providers to talk about this care. The aftermath of cancer is so important, just as important as the treatment that you received. Thank you so much for having me today.